Hi, it's Dr. David Morris with Magnolia Medical Center, and I'm here to go over another short little video on something that you can do to help if you have neuropathy. Okay, so what do nerves need? Something that nerves need in order to be healthy. Vitamin D3. They need vitamin D. The best source of that, if you're going to supplement your diet, is D3, not D2. So vitamin D3 is needed for nerves. There's tons of studies that have been done specifically surrounding neuropathy related to diabetes, so diabetic peripheral neuropathy. And they show that vitamin D significantly impacted or improved pain levels in people that were suffering from neuropathy related to diabetes. There's over 100 known causes to neuropathy. Diabetes happens to be one of the most common. If it were me and I had neuropathy, I would certainly, even though the studies haven't been done around it, I would be taking vitamin D3 no matter what the cause of neuropathy was. But specifically in the studies regarding diabetes, vitamin D3 significantly improved the condition. So what does it do? Vitamin D, what the research shows is it decreases inflammation in the small little capillaries and the small blood vessels that deliver nutrients to the nerves. Look, if you can't get nutrients to the nerves, there's zero chance of those nerves healing. They're going to continue to die. They're going to get worse over time. Vitamin D3. Vitamin D reduces inflammation in the body. In this case specifically, the research shows it's reducing inflammation in those small blood vessels, thereby allowing those blood vessels to be a little bit more open, a bit healthier, and even regrow new blood vessels if they're not constantly inflamed. So we want to reduce inflammation in the blood vessels that deliver nutrients to those nerves. And if we can get nutrients to those nerves can heal, they can be better, and therefore the person can experience less symptoms and less pain. So vitamin D3 is going to be key. Most people in North America are deficient in vitamin D. We're just not out in the sun. Neuropathy sufferers, they're stuck inside. They don't go out walking. They don't go out ride their bike. They're not outside enough to get vitamin D from the sun, so they need to supplement it. We like a vitamin D3 as a liquid. You should take about 35 units. I'm not giving you medical advice here, but 35 units per pound of body weight per day. And that would be a minimum level that you should take. The research, when they did it, they actually were giving people an IV of vitamin D, and they did 300,000 units. Don't do that. Don't do that. But they gave them 300,000 units. And the people they did that in the research, their pain and their symptoms dropped remarkably based on vitamin D. So if you're suffering with neuropathy, make sure your vitamin D levels are good. If they're not, make sure you're taking enough. You may need to take a little bit more to get them up, but vitamin D can be helpful. I want to thank you for watching. If you're suffering with neuropathy and you need some help, call our office. This is what we do. Don't believe it when somebody says nothing can be done. The number here at Magnolia is 615-225-9100. We look forward to seeing you in the office.